Hello, welcome to our channel. I hope you all are doing well. So in this video, we are going to discuss the case notes for nursing profession, and I'm going to discuss the case notes. Patient's name is Anne Ballard, and also we'll be correcting a student's letter, and I'll be providing you the sample solution for the same case notes. So let's have a look at the case notes first. Okay, we'll read the notes here. You are the nurse on duty at Children's Hospital. You have been caring for this patient, an infant. Details of the patient: Anne Ballard, 22 months old. Next of kin, Kristen Ballard, mother. Now we'll have a look at the task so that we can just know to whom we are writing the letter, who's the reader. The writing task says, using the information given in the case notes, as the charge nurse on duty, write a letter to the patient's local maternal and child health nurse outlining relevant information and requesting follow-up on discharge. So, we have to write a letter to the family's local maternal and child health nurse outlining relevant information and requesting follow-up on discharge. We have to address the letter to Greenville Maternal and Child Health Center, Main Road, Greenville. Great. So we are writing the letter to the family's local maternal and child health nurse. Okay. Now let's have a look on the case history. Admission date 16th of March 2010. Discharge date 22nd of March 2010. Diagnosis: second degree burns to right trunk and arm following accidental scalding with hot water. Okay. Family: lives with mother and 4-year-old brother Tom. And background of the patient says mother, she's 28 years old, separated from husband 4 months ago. Financial difficulties following separation. Housing: a 3-bedroomed house in new housing development. Family reliant on public transport. Socially isolated. Kristen's patient are interstate and she has few friends. Kristen is depressed and children spend alternate weekends with father. Moving further towards a medical history and medications. So no medications, nil significant history, no known allergies. Then management in progress during hospital stay. Okay. Twice daily Silvazine dressings to the affected area, IV fluids for 24 hours post-admission and then oral fluids, medications, prophylactic antibiotic cover and analgesia, mother referred to hospital social worker. Then the discharge plan says daily Silvazine dressings, no discharge medications, monitor mother's mental state, introduce to local supports, for example, mother's group, activities, local child care center, etc. Appointment with local financial counselor for financial problems. So these are the things which we have to inform to the reader, which he has to do for the patient. Okay. Now we have gone through the case notes and we are very clear there is no medications, no significant histories there, and these are the medications, and mother has been referred to hospital social worker. And if we talk about the background, she has been separated from husband, she has some financial difficulties and socially isolated, and also she's depressed and children spend alternate weekends with father. Now we'll discuss the letter written by one of our students and also the correction, how the letter is being corrected and how we are going to grade the student. Okay, here we have a letter written by one of our students and I have corrected it and I'm going to tell you what mistakes student has made. Subject is good, fine. Now introduction says, I'm writing to refer Mrs. Kristen Ballard and her daughter Anne Ballard, who is due to be discharged today from our hospital following an admission with burns. Here, everything about the patient, chief complaints have been written here and it's very clear what are the chief complaints and the letter is about who. So, the letter is about mother and daughter who is 22 months old and due to be discharged following an admission with burns. Now, the purpose of writing the letter is they need your assessment and follow-up after discharge. Here, Will should be written. As per grammatical rules, will should be there. They will need your assessment. Then in the next paragraph, the body paragraph 1 says, Anne Ballard was brought into hospital with second-degree burns to right trunk and arm due to accidental scalding with hot water. During hospitalization, she was treated with IV fluids and daily dressings. Here, the mistake is here. It should be and daily dressings with Silvacin. Silvacin S should be capital as it's a brand name. In addition, antibiotics to prevent infection and analgesics were also administered. Now, moving towards the second body paragraph, patient social history. In terms of social history, Anne lives with her mother and her elder brother in a new housing development. Moreover, Mrs. Ballard got separated. So, no need to write separated from her husband instead of his, it should be her recently, and has been suffering from financial difficulties since then. Since her parents live out of state, she seems socially isolated, not isolate, and depressed. Then student have mentioned so. So is an informal word. Instead of so, you should write therefore. She has been referred. Spelling of referred is wrong. Here is a spelling mistake. To a social worker. Now, the next paragraph, the last one, in which we have to convey the message that it would be greatly appreciated if you could arrange someone to dress the baby's wound. Kindly monitor Mrs. Ballard's mental state, and it would be here it is written greatly. So greatly is already been mentioned earlier, so it would be a repetition. So we will not write greatly here. Instead of that, we can write would be really beneficial for her if you could introduce her to some local support groups such as a mother's group and local child care center. Please note that she will need an appointment with a local financial counselor to sort out her financial problems. Then this line is always included in any letter. Should you need any further information, please do not hesitate to contact me. Yours faithfully, leave one line, child nurse, then your address, children's hospital. Fine. It was good. It's okay. Like according to me, I would grade this student B grade. This letter can get B grade. So according to me, the letter is good one, and the student has selected the case notes very nicely. Appropriate selection is there. And also the grammatical few errors are there. Otherwise, the paraphrasing is very logical, and according to me, yes, this student can get B grade. If the similar letter can be written in exam, yes, B grade can be awarded to this. Now I'll discuss the sample letter. What is the exact sample letter? See, writing a letter can be of many types. Everybody has a different style. This is also fine. Few mistakes were there which we have already discussed, and I'll show you another one which is not having any kind of mistakes. Okay, now you can see a sample letter in front of you on the screen. So introduction can be, Anne Ballard was admitted to the Children's Hospital on 16th of March 2010 with second-degree burns to her right arm and trunk after being accidentally scalded with hot water. Then it's mentioned that her stay was uncomplicated following the usual course of dressings, analgesia and prophylactic antibiotic cover. Then we have mentioned that Anne will be discharged from hospital on 22nd March 2010. She'll require ongoing daily silvazine dressings to the affected area. No other treatment is required. Next one is Anne's mother, Christine Ballard, has recently separated from her husband and appears to be very isolated. She also has financial problems and would benefit from meeting with a financial counselor for assistance with these problems. The staff are concerned that Christine may be suffering from depression. Then Christine would also benefit from your support and monitoring, in particular your assistance with linking her into local support services and networks would, I believe, assist in reducing her isolation. Then the last one, thank you for being involved with the family's ongoing care. Please do not hesitate to contact me if you require any further information. So we have conveyed the message also. We have selected the case notes which are very necessary according to the scenario and according to the reader. So this is how you can write this letter. I hope you have understood well how to write this letter and how the letter is being corrected. If you also want your letter to be corrected, then please send your letters and we'll correct it and we'll discuss it. And like this was one of the letter we got from one of our students, and I have discussed the solution also, the correction also. So keep on watching the videos and stay tuned, practice and practice, and I wish you good luck for your exam. And keep on practicing, keep on watching our videos for guidance, and thank you for watching this video. Good luck.